I want you to imagine. I want you to imagine, if you can for me, the day you were born. Unrealistic, right? You can't really imagine that.
On July 14, 2016's new cohort of Health Equity Academy scholars assembled an audience of faculty, staff, and students for the culmination of their summer experience. The presentation was about the West End community in Durham and its population. It covered subjects like access to healthy food, communication within the community, and affordable housing for the residents. Most of all, it served to bring information about a nearby community that people at Duke might know little or nothing about. And in a way, that is what the Health Equity Academy is all about. The Health Equity Academy focuses on social determinants of health, health access, health disparities, diversity, and health equity in the preparation of HEA scholars destined to become the next generation of minority nurse leaders. Scholars who are admitted to the program attend seminars, participate in public service, and have community-based experiences, and attend professional development courses, and a variety of other activities. They also learn about the possibilities open to them in a career in nursing.
This program has definitely allowed me to realize the possibilities that are out there. So every day we were going around to different classes, workshops, and shadowing, and we were meeting, not just registered nurses, but nurse practitioners, doctors, nurses with their PhDs, CRNAs. So it made me realize that registered nurse isn't just where I can stop, that I have the opportunity to keep succeeding and going higher, and that at the same time I have support behind me. If I don't know what to do, I have somebody to ask questions about, should I get my PhD or should I get my DNP? So it definitely allowed me that I can continue my education.
The program was established to do more than just allow students to learn about careers in nursing, though. It also teaches them about health disparities and circumstances that might be unique to a particular population.
Being a part of the Health Equity Academy this past summer was very enlightening for me. I came into it initially not knowing too much about health equity and the importance it plays in healthcare. And this past summer, it's really opened my eyes into realizing that there are a lot of different circumstances that people have to deal with, whether that be where they live, grow, work, and age. And being able to come here this summer and just immerse ourselves in classes, lectures, and just building a cohesive team with the other scholars was very beneficial to my summer.
Dr. Bridget Carter, who's overseen the program for the last 3 years, says the Health Equity Academy is about addressing a serious problem and one that has real-world consequences.
So the Academy for the Health Equity Academy is significant in that we really need an avenue in which to create and support minority nurse leaders, and also to really develop students who have a really good understanding of health equity and social determinants of health. And one of the reasons that's important is because we often are meeting patients and treating patients and communicating with patients and really not understanding the background in which they come from, thereby making our care really irrelevant in terms of what they're dealing with in their own lives. So this program really immerses them in social determinants of health. They really learn about their local community in which they'll be serving over the next 16 months. And long term, this program really gives them a support system to help develop themselves not only as leaders but future practitioners. And we also support many of them as they move into doctoral programs, and whether that's clinical doctorates or nurse practitioner degrees, and whether that's PhDs. So we really expect that my first cohort from this program have already moved, all 4 have moved into doctorate level education. Some are serving in the Peace Corps, but they all do have leadership development skills that they're carry with them for the rest of their life.
This fall, the new cohort of Health Equity Academy scholars will begin the ABSN program, and then, hopefully, long careers in the nursing field.